Hello, I'm Dr. Gerbarg, and I'm here to talk with you today about using some special healing breath practices to help during pregnancy, delivery, and afterwards. And I also have with me a special guest, Phyllis Arias, whom you'll meet later, and I'll tell you about just before she comes on. So I'm a psychiatrist, actually an integrative psychiatrist, and one of my special areas of interest is finding ways to help people without having to give them medication. And of course, that's especially important during pregnancy and during breastfeeding. We like to minimize the amount of medication that we put in the mom's system. So what we find is that we can use certain breathing practices to help reduce the effects of stress on the mother and the infant without having to take medications, which, as you know, can have bad side effects. If you would like to learn any of these practices, I don't have time to go actually teach them, but there are other programs we did during the last 2 weeks that you can click on where my husband, Dr. Brown, and I actually teach how to do the breathing. And also, if you want, you can get one of our books, The Healing Power of the Breath, that has a CD with it that will also help you learn how to do what we call coherent or resonant breathing. And that is simply breathing at a slower rate, somewhere between 4 and 6 breaths per minute, with an equal inhale and exhale, and especially breathing very, very gently and softly, not overfilling, not pushing the air, really in a very, very relaxed and natural way. And what that does, we have found over the years, and we've been studying this now for about 20 years, is that it is the fastest and the simplest way to balance our stress response system and help us be more stress resilient. Now, pregnancy, and I speak from experience having had 3 children who are now all grown, pregnancy is a stressful situation. All kinds of things are happening, and many things are new. It puts a stress on everyone. So we already know that. And of course, under the current situation with the pandemic, our lives have this added layer of stress. So we felt it was especially important to help mothers who have to not only manage their pregnancy, but a house full of kids and who knows what else is going on, financial worries. All of these stresses can affect you. And it's very important for your well-being and for the well-being of your infant, as well as everybody else in the house, because I believe that mothers have the power to set the tone for the house. Fathers do too, but mothers have something also special. So if we can learn how to regulate our own physiology and use that to maintain a calm, centered way of existing, then we kind of become the Rock of Gibraltar, and everything else is swirling around, and we are just centered and steady. And that will then steady and center everyone around us. So this will increase your ability to manage your emotions as well as your entire household. Now, it turns out we've always known kind of intuitively that the emotional state of the mother has effects on the baby. But only recently have we been able to actually measure those effects using electrocardiograms and all kinds of echo and all kinds of other systems. And one of the fascinating aspects of this is that what we're finding is that the way that the mother's nervous system is working has a lot of effects on how the developing baby's nervous system is working. So once we know that, now we have a tool whereby if the mother can learn how to regulate her stress level, her anxiety, if a mother can learn how to stay calm or how to calm herself down when she gets upset, which we naturally do. The point of this is it's not that you never get upset. The point is you want to reduce the amount of time that your system is running in a state of sympathetic overdrive, where you feel unsafe and worried and tense and defensive and all these things that happen to us automatically because we're human. You know, it's nothing abnormal. But when you're under kind of abnormal circumstances and your system is overreacting, then we have to take action and do something to bring ourselves back to center. So we find if we can get the mothers to slow their breathing down to a coherent rate and do it very gently, within a short time, usually just a matter of minutes, this will calm the mind. It turns off the worry centers. And, you know, definition of mom is worry. We know that because we have all this responsibility. We have to learn how to manage responsibility without constantly worrying about one thing and another thing. So this breathing will turn off the worry centers, and at the same time, it will turn on all of those aspects of the nervous system that enable us to feel safe, confident in our abilities, and also that enable us to relate to others in a softer, more loving, more supportive way. Because, you know, when you're tense, you know, you give off a lot of body language of tension. Even if you don't mean to, you go, you know, you kind of scowl and your mouth is tight. And, you know, children pick this up. Everyone, you know, around you can be affected, even if you're not even angry at them, if you're just worried. So you want to have, if you can, a calm expression that reflects a calmness that's inside you. And that will tell your children, if mom feels safe, well, then they're safe. Or if dad feels safe, then everybody's safe. So this is important both for mothers and fathers. Now, the other thing I would like to mention is that this is very good during pregnancy, because when the mother regulates what's called her own heart rate variability, that's just a measure of how her autonomic system is functioning, then we can actually see that in utero, the baby's heart rate variability is better. And that's a very good measure of health, and has also been associated with higher birth rates and a lower incidence of premature births. So this is very good for your baby physically. Now the next stage, of course, is delivery. Well, there again, coherent breathing is actually, I think, the best way to get through pregnancy. And I know quite a few women who, you know, back in my day, Lamaze was the thing, and that's what we had and that's what we did. And so but I see women who have done Lamaze and then in another pregnancy done coherent breathing, and they tell me that the coherent breathing is much better because, first of all, it helps them stay calmer and more relaxed. And secondly, we're not doing that intense, almost hyperventilating breathing, which is exhausting when you're already exhausted. So this is just a very calm, gentle way, and it helps the person get through their delivery process in better shape with less stress. It also reduces the perception of pain. We're activating the anti-pain part of the nervous system. So that's a plus, especially during labor and some of those contractions. And it also has anti-inflammatory effect. So that's going to help everything in the body heal better. And after delivery, of course, when you have that little baby in your arms, what you want to do is be transmitting your calm relaxation to your baby, because we know that babies develop neurologically and emotionally through co-regulation with their caregivers. Okay, so that skin to skin or close contact where you and the baby are together, you are actually regulating one another's physiology, and that sets the foundation for your baby's emotional development throughout infancy and later life. So those times and how you handle that baby and how calm you can be and how loving and nurturing, you have a tremendous ability to get your child off on the best possible basis towards healthy development and strength within their own self-sustaining nervous system. So Phyllis Aries is going to talk a little bit more about how she works with mothers and fathers and infants to help that whole process of co-regulation. And of course, we've also heard Dr. Steve Porges give a fantastic talk about the Polyvagal Theory, which you won't want to miss, because then he goes into the science and all the implications. It turns out that this is the system that enables us to relate to each other, to really be there for one another, to communicate, And this is the system that we need to activate and strengthen. Because when we're threatened, what happens is our defense system takes over. You know, we either want to run away or fight or something, but we're not really relating to people. And so we need to calm down the defense system and reboot and activate our social engagement system. That's what relationships are all about. And this, especially because we're around each other, you want to have a positive interaction as much of the time as you can. So you could do the breathing in the morning for a 20-minute period. And then anytime during the day, when you start to feel stressed out and notice that you're tensing up or you're snapping at people, take a little break, even 5 minutes of coherent breathing, and you'll be able to reset yourself to the place you want to be for yourself, for your own health, as well as for everyone around you. And you'll be amazed at how this helps your relationships as well. So Phyllis has told me so many amazing stories about her work. She is a breath, body, mind teacher. She came and trained with us. Our program is Breath, Body, Mind. And we discovered that she works with high-risk pregnancies, as well as with babies and parents in neonatal intensive care units. So there is very challenging because the baby's in an incubator, and that reduces the amount of time when they can have co-regulation time with their parents. It's very stressful for the parents, and it certainly puts an extra stress on those babies. So she has come up with ways to help parents deal better with that and to compensate, and for the babies and the mothers to be able to regulate better, which enhances every aspect: feeding, growth, emotional development. So it's a very important area. Phyllis is highly trained. She's also has degrees as a craniosacral therapist, as an occupational therapist, as an infant massage therapist. All of her work has specifically been with infants. And for the past 7 years, she has been incorporating these breathing practices, especially coherent breathing, into her work and developing a whole integrative, beautiful system for working with even the most extremely stressed families and babies. And she works with them from the time they're admitted with a pregnancy through delivery and after. So I would love to now introduce Phyllis Aries.
Hello, I am so happy to be here with all of you to support what I feel is really very wonderful use of integrating all of the different therapies that are out there. What I would have to say is what I tell a lot of mothers in the pre-delivery, delivery, after, is that they're going to get a lot of information about what they can use. And sometimes it gets a little overwhelming, you know, which thing we have so much to offer now that with this new experience of challenge that we're going through, there's so much online. And what I would say is that you can almost image a big bag, like a Mary Poppins bag. And you're throwing all of these different resources in. You're getting a sense of which ones work well for you, which ones are good to combine. And I would have to say that what I want to focus on today is coherent breathing in combination with craniosacral therapy, as having a special pouch, maybe that little zipper pouch in your Mary Poppins bag. So you can easily find them, bring them out together. And I would add one other technique, because like Pat is saying, we really need to find ways to balance our nervous system. With our babies, it's really us. It's about finding a way to help ourselves. So I've seen beautiful responses for babies, moms, dads, grandparents, partners. And I would say if there's a way to sort of find those pieces that work for you and how they work for you, to build trust in yourself so that your baby has a resource for you. What I want to do is talk a little bit about the concepts as I go along. So here's my baby. And I would like to start with one thing that I find is really helpful. Maybe you're familiar with this. If you're not, I'm going to go through some basics. Kangaroo care is something that is used widely in neonatal intensive care. I think people are aware of it, even at home. It's the skin to skin holding of your baby. And so the thing about skin to skin holding that is really amazing to me is that the connection that happens is so strong and physiologic, because the mother's chest, if the baby's cold, the mother's chest actually heats up to warm their baby, and vice versa. If the baby's too warm, the mother's chest cools down. So that right there tells us that could be extremely helpful as an important thing to help our nervous system settle, to help our baby. And what you want to do is, I'm going to turn a little bit sideways, because with craniosacral therapy, one of the concepts is that you really are honoring the wisdom of your baby and yourself to find your way to help. So when you're holding your baby, you want to have your hands in a way that is very soft and not creating any kind of tug, because their body, when you can get yourself to soften, to use the coherent breathing to slow your nervous system down, and to let your baby find a way to slow their nervous system down, what you can do is lean back, distribute their weight on you so that you don't have to press or pull. You're going to have one hand on the base of their spine and their bottom, and you're softening. So as you're softening, it might be tricky to do, so you're going to use your coherent breathing, which is, if you're not that familiar with it, inhaling through your nose, exhaling through your nose, and you're using the sound of the chimes to really allow you to have that nice rhythm as you're breathing. So I have seen this work with babies that were being held by their moms. And once we started the coherent breathing, you could see, because in intensive care, I have all of the monitors showing what is happening. The baby went from their oxygen levels going down and fidgeting as they were refluxing to a nice, soft place, settled place. And you could see the oxygen levels coming up. So I have the advantage of seeing all these things happen on the monitors. As you're breathing, there's what is called breath moving. So what you want to do is just let yourself recline and soften. If you find that thoughts are coming in, that you are having a hard time settling, you can let yourself image what it feels like, what the sensation, some of the mindfulness techniques. What does it feel like as the air is coming into your nose? What does it feel like as it's coming down to your belly? Letting your belly soften. And in pregnancy, you're going to do the same kind of thing. You're going to have your hands just on your belly. It might be a little bit trickier to breathe. So what you want to do is and you can do this in pregnancy, before, during, after. You want to let your lungs on the sides, on the back, all expand. Let your diaphragm drop down, soften, and let that breath come in nice and slowly. With the breath moving, as you're breathing, you can image the breath coming into your left hand, nice and slowly. Inhale through your left hand, come up into your heart. And you want to open your heart. That is what is going to allow you to have a soft, rolling breath and bring that love around down your right arm, back to your baby. You can do this as a very soft, rolling breath. It's sometimes hard in the beginning to learn how to pace yourself with the chimes. So what you can do is just keep a nice, soft, rolling breath and inch your way. It may take a while. So you're going to inhale up your left arm to your heart. Exhale down your right arm, bringing all your love to your baby. Inhaling up your left arm. Let your heart soften, open to all the love that you're feeling for your baby. Exhale down your right arm, bringing all your love back to your baby. One more time, inhale, up your left arm, into your heart. Exhale down your right arm, creating a beautiful circle of love. You can do this in the middle of the day, and if your baby wakes up and is very upset, this might be enough time to have your baby go from a very upset state, fidgeting, can't settle, maybe just a little bit of time settling together. Right now, with everything that's going on, we are going through a place of not feeling very safe. So one thing that mothers have told me they've loved in the intensive care unit, because there's not as much of a sense of safety there, is to inhale, and I'll talk you through it. You inhale through the back of your legs, up from your feet, and all the way up to the top of your head. Exhaling, creating a nice bubble of security around you. So you're going to inhale, back of your feet, up the back of your body. Exhale, bringing a bubble of security and love for both you and your baby. One of the feelings that I often find mothers can use is going into their heart and letting their spine move out and decompress, letting their heart open. Now, you may need, again, some other tools. This is what we can do for ourselves that is really a way of helping our babies. So you're going to use the breath moving. You can use it for yourself. You can use it for your baby. If your baby, one of the things that I find is very common with babies is they have gas or their digestion, they're really struggling. So with that, one of the things you can do, and coupling that breathing to keep yourself supported in that nice slow tempo. You're letting your one hand be on your baby's bottom, and then the left side of their body, very low, is where their colon is. And the one thing about the craniosacral is that it's a very soft hold, like I was saying, because part of it is we need to decompress. You know what it feels like when you're opening up and softening. So in order to do that, we're not pressing on our baby. We're imaging almost like a sheepskin blanket, this soft hold between our baby and our hand. And we are going to just have that very soft hold. And what you want to do is sort of see, how does your hand feel? How is your skin? How are your arms? You can sequence through, soften my shoulders, soften my hands. You can talk yourself through this and allow your baby to use you as a resource. We have a way to metabolize our baby's stress by settling ourselves, and they can draw on us for this. That is really what's going to allow their digestive tract to start squeezing, because that balancing of their nervous system allows the part of our body that lets digestion happen. So what we want to do is just soften, and then it's natural to just want to pay close attention, but you know, if somebody's really looking at you like this, that it starts feeling compressive. So again, with your baby, the same thing with kangaroo care, you're going to want to just soften yourself and have a sense that you are with your baby. That the experience is that you're together, not as much that you're keeping vigil on your baby. So you're going to soften your hands, soften your body, use the inhale and the exhale of the coherent breathing. I'm finding that coupling the coherent breathing with these techniques of craniosacral therapy really lets that inflammation come out of the baby's digestive tract, so that their motility, that movement in their digestive tract, can really take a hold and work. So the baby might be fidgeting, you never know. There was one baby, the nurses, many of them have learned to trust that it's a process. So we need to not only practice this and understand that it's like the violin, we need to practice in order to really integrate this work. So if it's not really working at first, that's natural. It may take some time. And that also for a baby who has gas or digestive problems, it may take them some time to settle, just as it takes us time to settle. And then they may settle for a period of time, and then they may get upset again and start squirming, which is not necessarily something that isn't helpful. So I was with a baby who was fidgeting all morning, and when I worked with them, they did get very upset, but then they had a beautiful digestion and slept the rest of the day. So it's not always that we're seeing an exact straight line. Another concept of some of this work, it is a process. So we need to trust and learn from the process. The other thing is with feeding. If you're breastfeeding, it's the same thing. If your baby is refluxing, you're going to have one hand at the base of their spine. You can try while you're feeding to have one hand at the base of their head and their shoulders, and really let yourself soften, looking at them and then bringing your attention back into yourself, and maybe even letting your attention go back even further to allow them to have that feeling where there is a space where the two of you are, that they can shift out and decompress. So with feeding, it's the same thing. You can, if your baby is refluxing, with the breath, you could inhale up your hand and then back down your arm. And you can accentuate the exhale if a baby is refluxing to really get that image of a downward movement. And the same thing for bottle feeding. It can be the same way. You can hold your baby and do the same kind of thing. So the other thing is that when you're with your baby and they're having a really hard time, they're really upset and you're busy, sometimes just the chimes. I know there were parents that were very doubtful that this work would actually help, and just holding their baby in the unit and letting the chimes go and starting to talk them through the breathing. I could see that the mom was trying to figure out how this would work or whether it would work. And sometimes the babies can lead the way, that they find the sound of the chimes is totally soothing. I went to the maternity unit. There were these two moms in the room together, and they just had the chimes going in the background and told me that was very soothing for them. So even if you're up and around and you're having to do dishes or whatever you're busy with, you can have just the sound of the chimes there, and it will really help you. So I'm grateful for having this time with you, and any questions I'm happy to answer. Thank you.
So thank you so much, Phyllis. Please stay with us.
Okay.
Wait and see if any of the viewers put up any questions on their chat box, which we can try to answer. So are there any questions? I'm not seeing any yet. Maybe a bit early in the morning for some people. If we don't get questions, what we can do is just continue talking about some examples and other ways to use practices until some questions come through on our chat boxes. If the HealthFlix official who's monitoring is if you're getting the questions on your box, please pass them on to us, because we do want to answer any questions that people may have. Okay, good. So Phyllis, you know, you told me some stories about one of the patients you worked with who went into premature labor and was going to be whisked off to the delivery room, and you were able to calm her down and actually stop the premature labor. Could you tell a little bit about that one?
Sure. So there's a mom I worked with who was pregnant with twins, and she was alone. She was not with the father of the baby. And I had the great fortune of starting with her before she started going into contractions. So we had plenty of time for her to start to learn the coherent breathing. And she loved it so much, she told me she used it every night to go to sleep, that she could not. And to this day, I've been in touch with her. She still uses it every night to go to sleep. So you can see how it's a process of practicing, because she went into a place of having very high blood pressure and having contractions. And so she would go from the maternity unit into labor and delivery. And I just really love how the staff in labor and delivery, they were so excited to have me come in. And even to the point where there's 4 beds with little curtains in between, they would turn off the lights in the room, let me turn off the lights, and then if they needed to be with another patient, they would get a little spotlight, because they really were understanding the value of having women learn how to soften and learn how to rebalance their nervous system. So I'm very excited to be able to use this work with medicine, because it is in high-risk maternity quite a marriage. It's beautiful to see. There were 3 times I was with her in labor and delivery where it was very dicey. She was going to possibly have to deliver. And she went from, I believe, 23 weeks to 31 weeks while she was in maternity. And each time, actually the last time I was with her, the 4th time that she started going to contraction, they didn't even bring her to labor and delivery. They actually just were like, oh, we're so glad to see you, go in there, see her here. So she learned coherent breathing. And like I said, it takes some practice. It is a process, especially if you have twins and your belly's big. And we know that breathing is your diaphragm dropping down, your belly softening. So like I was saying, if you can even practice the value of using all your lungs, and even with the masks nowadays, when you're out, I've had fellows come to me and say, I can't breathe. Medical fellows, and I'll teach them with the mask. And it's a similar process. We have our lungs in the back of our body, on the sides. We have a way of letting ourselves soften, letting the diaphragm drop down, and really allowing us to use all of our lungs. So it's the same in pregnancy with the big belly and the twins, and she learned how to navigate all of that.
Yeah, I do just want to pick up on a couple of things that you've mentioned here. Um, with people who have physical limitation to their breathing, and it may be from carrying twins or whatever, if initially the person finds it's a bit of a strain to try to breathe at 5 breaths per minute, they can begin at 6 breaths per minute. And then once they get that, they can slow down a little bit at a time. So in our book, we have chime tracks to pace people at 5 and at 6 breaths per minute. Or people can just Google around and get apps where you can adjust the rate of breathing to a comfortable place. And you may be starting at a higher rate, but you just kind of ratchet it down a little bit at a time. The point is to do it in a way that's comfortable for you. If you're really straining to slow it down that much, ease up, go back to maybe 6 breaths per minute, and then bring yourself slowly, slowly down to the 5 breaths per minute. And the other point I wanted to pick up on was that this type of breathing will lower your blood pressure. And that's important for all of us, but especially during pregnancy. So breathing at 5 breaths per minute will help some. If you can get your breath even lower, even slower, that will even more. Also, a lot of elevation of blood pressure is from anxiety and stress. So if we simply reduce that, the blood pressure will often come down by itself.
Right. And the other thing about this woman that was so remarkable is that, you know, her babies were born and she had to navigate the neonatal intensive care unit, which is not an easy thing to do. So the thing about her is that she kept using the coherent breathing, like I'm saying, so that creates a baseline. When you can keep using it at certain points in your day, whatever you can do, that helps you start at a place where your nervous system is already not quite so ramped up. And the important part about that is she had to learn a lot of things. She had to understand a lot of things. She had 2 babies. She's trying to figure out, what are the doctors saying? What kinds of decisions should she make? And that, in addition to all of the information once they started eating, how to hold them, what to do to help them with their own breathing. So you can imagine that if I was sitting with her and her nervous system was ramped up, that really what it does is it stops us from being able to process. We understand that now.
Mm-hmm.
If our nervous system is ramped up. So if you're home with your baby, it's going to be hard to figure out how to best help them through their day if your nervous system is ramped up. So doing these things, requiring yourself to soften, to really let your nervous system come down. She was then in a place where I could teach her, for her babies being younger, they're doing a different kind of breathing while they eat. So if she hadn't been able to do that, it would be very hard for her to be able to take them home. So coupling all of these experiences where you can really focus on yourself. This is sounds in the past that this is selfish, you know, and now we really understand. It's almost like a 2-for-1 deal. You help yourself, you help your baby. So we really can use that kind of situation. She was able to really get them out of the unit at an extremely young age. By 35 weeks, they were both going home. So yes, they could have still been in her belly. So they really did tremendously well. And I had the great pleasure of being with her, having that nice concept of the craniosacral therapy where we're not getting too intensely vigil with our baby, watching them closely, their move. That can be so compressive for us. So the concept in craniosacral therapy is you're letting your presence come forward and you're creating this container of space around you that is the right amount of space to feel soft and settled. So as the baby's mom, you can kind of come close to them with your presence. And then it's just like if a dog came into the room behind you, scratching at the door, you're letting yourself telescope, slowly bring your attention back. And at a certain point, you're going to find this sort of sweet spot where it just feels right. And that is the container for you and your baby. And that will support them in decompressing. And like I said, to come there, to come to that place, we need to be settled. So the tools of combining the coherent breathing, maybe the mindfulness, if your heart feels so jittery, you can combine that feeling of what does the breath feel like to help yourself find your way to being there for you and your baby.
Phyllis, we can't thank you enough for sharing just the depth and the richness of your experience. And it just, you convey it so beautifully in the way that you share with us. So we thank you. I know we have to be stopping now, but I would love to talk about this more with you some other time because it's just beautiful. Thank you so much.
Thank you. And thank you for all of your work.
Okay. Bye-bye.